So are you studying for your Nclex exam? But did you know there is a huge difference between sign and symptoms? Now you must be wondering, oh, that's the thing that we didn't even know that there's a difference between sign and symptom, right? So now what's next? What can we do now? So in this video, I will tell you how to differentiate between sign and symptoms. Who knows, some of you might have Nclex exam tomorrow or any healthcare exam tomorrow, right? And maybe your last question is gonna be on sign and symptom. So now after watching this video, once you learn how to differentiate between sign and symptom, and maybe your last question on an Nclex is gonna be on sign and symptom, and you should be very confident that I gave my answer correctly because I just learned one night before after watching this video before my exam that I'm very confident that I know the difference between sign and symptom, right? So let's learn about sign and symptoms. It's gonna be super quick, easy video. So let's discuss about sign first. How to tell what's the difference between sign and symptoms. So sign means like when you can see from your eyes, and when you can see from your eyes also you can measure the numbers. That's called sign. So let's say if I can see from my eyes, like if I can see the redness or rashes on the patient arm, that's a sign, right? And if I'm checking there anything visible from your eyes like redness, discoloration, rashes, that's come under sign, right? Anything you can measure, like what can you measure? So let's say you can measure blood pressure, the numbers you can measure, right? 120/80, that's a sign. Pulse, you can measure the numbers, that's a sign. Heartbeat, you can measure, that's a sign. Also when you checking the sugar, right, there is a sugar number on the machine, that's a, you can measure the number, that means sign. The patient has 302 sign of hyperglycemia, like you can say that. So that's the thing, that's sign. Now let's discuss about symptoms. So symptoms means uh, symptoms, they talk. You have to know this way, the symptoms, they talk. What is that meaning, you must be wondering, right? So symptoms talk means when the patient will tell you his or her feeling to you. Like patient gonna say it's all about feelings. The patient gonna say it's all about feeling that you cannot see. It's only telling by the patient. So let's say a patient gonna tell you, I'm feeling dizziness, I'm feeling headache. So that's a feeling, right? You cannot see dizziness, you cannot see headache, but that's a feeling, right? So I'm feeling dizziness, I'm feeling itching, I'm feeling dizziness, I have body ache, I'm feeling nauseated. So all are those symptom, right? If patient gonna say I'm having pain on my left shoulder, that is also symptom. So now when you're charting, you can say patient has a symptom of right shoulder pain 10/10, like that. Patient has sign of 502 sugar. You see the difference? So sign means you can see from your eyes and you can measure two things, sign and measure. But symptom means only the patient will tell you his or her feelings. So that's the two different thing. I hope now on you will be able to tell the difference between sign and symptom. And one more thing I want to mention, because when you're taking your exam, make sure you're reading the question very carefully, because they're going to ask you what sign you're going to see on the patient. Another thing, they might ask you what symptom you're going to see on the patient. So there are two different things that you should be very clearly understood. Both are two different things. Another thing is sign is objective. Objective means you can observe, and the symptom is subjective. Subjective means when the patient will tell you something, right? Patient is telling you something. So here is another thing you learn during your exam. If they ask you what's the difference between subjective and objective, so subjective means that somebody is telling you something, and objective means that you can observe from your eyes. Like you can observe the patient has skin discoloration on forehead, or skin discoloration, rashes, or anything that you can see from the sign. Another example, when you're driving, right? When you're driving, you're reading the board, right? You're reading the sign. So that's mean you can see from your eyes. So I hope if you have exam tomorrow, any healthcare exam or any nursing or any Nclex exam, it's pretty clear to you what's the difference between sign and symptom. So I hope when you see any question about sign and symptom, you will be able to crack your answer immediately, and you will come home where you will come home very confidently that you gave the right answer because you just watched the video one night before my exam. And that's really helped me, and good luck.